Doc, can you give us an idea of the profiles of your patients now, yung COVID patients? Like how many of them are fully vaccinated? How many are just vaccinated for one dose? How many of them are not vaccinated at all? Parang ganon.
Kanina, we had a meeting and I said, they might ask me of the profile, right? So we looked at the 150 admitted this morning, and 85% of them are unvaccinated.
Oh, wow.
11% are partially vaccinated, just got one dose, and then the rest are fully vaccinated. And then, so clearly, well, some people will say, talaga namang mas maraming unvaccinated pa din, right? So if you look at the ratio of vaccinated and unvaccinated, maybe what we're seeing is a representation also of pretty much the vaccination status of the community, right? So
yes,
on the other hand, the thing that strikes us is all ICU patients, those who are critically ill, are all unvaccinated.
And what are the demographics? Are they, as usual in the A2, A3, priority list, the mga seniors and persons with comorbids?
Marami, as usual, may comorbids, a few seniors. We are also seeing a little bit a trend of younger patients coming in, which is probably a reflection that they say this Delta gives you a higher viral load, and maybe kaya ganon, no? And I was told by...
Pala yun. Kasi nababasa nga namin na parang there are more younger people, di ba? I mean, there are more of them, the younger people.
Correct. Now, the other segment na nakatakot, we're always concerned about the senior citizens, right? Kasi vulnerable, so we really have to protect them. But in the pediatric COVID ICU, we have about 6 patients who are COVID. These are kids who obviously are not vaccinated because they're not part of the priority, and we're not giving vaccines to kids. So we have some infants, a little bit younger group na wala pang bakuna, no? Which in a way tells us na, these kids probably got COVID from their adult household members. Hindi naman lumalabas yan, no? So, which brings home the point that I think we really have to vaccinate everyone. Or you get vaccinated not only to protect the elderly, but you also have to protect the young ones because they have no access, or right now they're not allowed to get the vaccines.
Speaking of which, sir, what's your assessment of the vaccine supply situation, particularly the participation by the private sector to bring in vaccines?
Well, there are challenges. AstraZeneca, this one that arrived in July, we were delayed 3 weeks. I got word that Moderna has some delay with the arrivals, but that is normal because everybody is scrambling for these vaccines, no? And I'm glad that the 3 million doses of what was donated to us by the Americans because of BB, I think arrived today. That's 3 million doses of Moderna. That's a big one, no? So, even the private sector, nobody is insulated from delays and challenges of delivery of vaccines. If Thailand goes into a serious situation, our vaccines that will be coming from Thailand will also be might meet the same delays. Novavax was ordered by the private sector and vaccine out of India, and look what's happening now. It can't be delivered. India has banned exports till September. We don't know. It might even reach October.
Okay, what about, you keep talking about vaccination being really the way forward, but even now we're hearing from other countries that the vaccines are slowly waning in effectivity, and that includes even Pfizer, which initially was said to be very effective against the Delta variant, no? Do you foresee us moving toward more boosters even while we still don't have enough supply of vaccines right now? I mean, kumbaga, we're catching up with what? We're too far behind to even catch up right now, or are we?
Yes, no. For example, in the case of the AstraZeneca vaccines, they're quite effective against Delta. But it doesn't mean that you are not going to get infected. You can get infected, but you are possibly be asymptomatic. Your illness will not be severe, and most probably you will not die. If you're unvaccinated, the chances of death is much higher. We have, and that's very clear. You can see cases here in the Philippines. I won't name the hospital. I asked the head doctor of this hospital. He has a lot of cases, but all of them are unvaccinated. So very clearly that the unvaccinated are the most vulnerable at this point in time. And all vaccines, even Sinovac, at that point in time, the government could not scramble for Pfizer and Moderna because they were all in high demand. So Sinovac has good protection against severe illness and death. Now, does it wane faster? Maybe possible, but eventually that's what we need to protect our people from severe illness and death. Now, down the road, I think the government will focus on good, stronger vaccines, but that all depends on the availability of supply. Pfizer, Moderna, AstraZeneca, Novavax, and J&J would be the most ideal to have. But even if you want it, you might not be able to get it because many countries in the world are facing Delta. They are also wanting it as well. No?
But what about projections in terms of vaccination and vaccination rates? Kanina, Secretary Concepcion did allude to that as well, no? That we're going to slow down. We might as well make the most of this slowdown and get as many people vaccinated habang mag-lockdown yung economy. What are we projecting and what would represent a missed opportunity in terms of numbers? What should we at least reasonably target by habang naka-lockdown? How much higher do we expect the vaccination of our population to go?
Well, Robbie, I think some of those who work with the vaccination program will have a better grasp of the numbers. But based on what I'm hearing, at least, for example, from Father Nicanor, they've reallocated about 4 million vaccines in the NCR, and I think the target is to get all those vaccines, done within the 2-week period. So that would be 2 million vaccinated people, or at least, maybe some for the first dose. My understanding is that we have at least 20%, more or less, of the population of NCR fully vaccinated. 20% would be around maybe 2.8 million. So if we could add another, 2 million vaccinated people, 4.8, we're getting closer to our target, which is around, it would be around 7 million for population protection. The projection would be, of course, it won't be done by August 20, but we think that perhaps by September or October, we'll get the 40 to 50% fully vaccinated in the NCR. And that will definitely help us long-term, because what we have seen in the US, in the UK, and Israel, they definitely opened up their economy, their businesses. They're on a boom right now. Consumer spending is very high in the US because of people, after more than 1 year of dealing with the pandemic. I think we're gonna see that here. So I'm actually quite optimistic about at least the fourth quarter that we're talking about.